Hey guys, how are you doing? In today's video, we are going to learn about and discuss UTIs, urinary tract infections in the elderly or in the elderly with dementia. My mom had a number of these when she was alive. My dad had some of these sometimes. So let's talk about it, see what we can learn together, okay? Now I'm going to read right here. I got some notes here, and everything we talk about is going to be linked in the description box below. So please be sure to go into the description box, read what I put there, and click on the links. It's not selling you anything. You don't have to buy anything. It's just more information to help you if you're in this situation, if someone you love is suffering with a UTI, or you believe or suspect they may be, and how you can go about helping them. Okay, guys? So, it says UTIs can cause sudden confusion, also known as delirium, in older people, in people with dementia. If the person has a sudden and unexplained change in their behavior, such as increased confusion, agitation, or withdrawal, this may be because of UTI. Now, I can tell you firsthand experience. My mom, when she would have UTIs, and she got a lot of them, her speech would be affected. She'd be mumbling like blah 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 blah. And when she had the correct medications, the antibiotics, all that went away, and she was able to speak perfectly. She was also went through extra bouts of confusion. Now, when someone has dementia, lives with dementia, suffers with dementia, they were already confused, right? Well, when they have a UTI, it gets worse. So if you notice that mom or dad, grandma, grandpa, whoever it is getting more and more confused or having trouble speaking and understanding things, or they're withdrawing from social activities or whatever it may be a UTI. Maybe you're a person who's elderly and you've noticed these symptoms in yourself, and maybe you don't have dementia, but you've noticed this. Strong odors of urine, really strong, could be a UTI infection. So you have to speak with your doctor, you have to speak with the nurse, you have to demand sometimes that you get the attention that you need so you can be treated and recover. Okay, so that's one part. That's some information about urinary tract infections. It says symptoms of a urinary tract infection, UTI, in older adults are similar to those in younger patients. They may include, sometimes they're similar, sometimes they're not. Okay, pain or burning while urinating, sudden changes in urinary habits such as increased frequency or urgency, pain or tenderness in your pelvis, lower back, or abdomen, fever, nausea, fatigue, cloudy urine, urine that appears red, bright pink, or cola colored, strong smelling urine. This is one that was really common with my mom. So if you have someone that you're caring for as a caregiver, and this elderly person has strong odor of urine, confusion, can't speak correctly, withdrawing from social events, they may have a urinary tract infection, and you want to request that from the nurse, the doctor. You want to make sure that gets done. Okay. Older adults may also initially present with generalized symptoms such as lower abdominal pain, back pain, and constipation. In the absence of fever, UTI symptoms in the elderly population can be atypical and include delirium, confusion, dizziness, drowsiness, falls. Now, falls are one of the primary reasons, if not the primary reason, for the death of elderly. When an elderly person falls, when an elderly, frail person falls, and their body has an impact with the floor or the ground, that can do extreme damage on the inside. Now, I'm not talking about what we already know as maybe they bleed to death. I'm not talking about bleeding. They might not bleed at all. But inside, internally, things get shaken up badly, you know. Maybe things move around and they shouldn't move around. Maybe veins get broken or something when the elderly body hits the floor or the ground, there's problems, right? So be careful. If you think somebody has a UTI, you want to get that treated immediately so they don't fall so all the symptoms they're having can go away. Urinary incontinence or poor appetite. That was another one my mother had, poor appetite at times. Every time she got the antibiotics cleared up, all those symptoms went away. Okay? Delirium is often reversible, but patients who develop delirium have prolonged hospital stays and complicated recovery. Now, this happened to my mother a few times. Again, I'm speaking from experience, being a caregiver for over 20 years. UTIs can be deadly. Just checking the time here, guys. I try to give no-nonsense videos. I try not to add things to the video, add music, or do anything that distracts you from watching the video or hearing me, because I'm trying to share with you important details that can help you, help your loved ones, help a friend, help whomever, right? Help you learn about what may be going on, okay? If you find value in this video, please give it a thumbs up. That helps the YouTube algorithm get the video out to other people who may need this information. And please consider subscribing to this channel, as more videos will be coming out. And please consider sharing the video with others whom you know may need this information as well. Okay? So you want to be careful with elderly, dementia, and then if they have a urinary tract infection, you know. Usually the tip is bad smelling, strong smelling urine, you know, more peeing, you know, her speech is off, or his speech is off. They're stopping him from socializing, right? They're more confused than usual. Even with the dementia, even with the Parkinson's, whatever they have, they're more confused. Keep an eye on that UTI. Ask the nurse, the doctor to do a culture or whatever they do to run the test to make sure there's no UTI. If there is a UTI, get the antibiotics in them immediately. And then after a few days or a day or so, if you don't see progress, get them to the hospital. If they don't do IV treatment there in the home or whatever, get them to the hospital. Call 911, get them to the hospital. If they're having a fever, it's not going away, get them to the hospital. That's important. I had to do that for my mother a number of times. And for another, you know, she'd go 1 year to the hospital, be treated, fine for a year. Next year, it happened again, be treated, fine for a year. So you got to make sure, if it's not getting better, guys, call the ambulance, call an ambulance, get your loved one to a hospital. Okay, just checking the time here. So again, there's links in the description box below, different things like senior UTI, do you know the symptoms, right? And again, we've gone over many symptoms that somebody could have. You know, frequent, urgent need to urinate. If you see mom or dad, grandma, grandpa going to the bathroom more often, that's another key, right? Painful or burning urination. If they say, oh I'm peeing and it's burning, that could be a UTI. You know, dark, cloudy, or thick urine, right? If they have more fatigue, fever. Again, I mention these again so you remember them. Frequent falls, confusion, dizziness, agitation or aggression, fatigue and lethargy, decreased appetite. Keep an eye on your loved one. If you feel there's a UTI present, speak to the nurse. Make sure they understand you want a culture drawn. That you speak to the doctor. Call the doctor. Find out where the doctor is. Find out what his number is. Call the doctor. Be nice, be polite, be professional, and insist that the doctor run some tests for your loved one to see if they have a UTI infection. And if so, treat it with the strongest, most potent antibiotics they can to treat the UTI infection. Now, a couple of times, listen carefully, guys, a couple of times, my mom had antibiotic treatments, oral antibiotics. They didn't work. 2 or 3 days went by, my mom was getting worse. I had to call the ambulance. She went to the hospital. She started on IV, intravenous antibiotics, and within a few hours, she was getting better. Fever was going away, blah, blah. She might have stayed 2 or 3, 4, I think twice she stayed 5 days. But she got better. She went back to the home for a year without any problems, you know. You have to make sure these UTIs are kept under control. Make sure they're cleaned often, changed often. Sometimes the nursing homes will put 2 diapers on a person. You know, that's really not going to help, I don't think, you know, because it didn't help so much in what I saw in my mother and what I saw other patients going through, you know, because if they're peeing, they need to be changed. If they're peeing, they need to be changed. Now, it's kind of difficult because you got to remember there's not a lot of people working in the nursing home. So, you know, I don't know what the actual CNA to patient ratio is, or nurse to patient ratio is. You know, there's a lot of work to do, and these folks do a lot of work, and they get burnt out and they're exhausted. And so you got to take matters into your own hand. If you think it's a UTI in the elderly or somebody severely disabled with dementia, or Parkinson's, or something like that, even if they're younger, call the doctor's office, call the nurse. Don't send an email. Don't fill out a form on the website to get the doctor Friday afternoon and might not get it Monday, Tuesday. Call the doctor. Can't get the hold of the regular doctor? Call the doctor on duty and politely demand, insist, my mother needs this test. My father needs this test. Grandma, please, doctor, help. Please, doctor, help. Get the doctors involved. You have a right to advocate. I'm not a lawyer. This isn't legal advice. I'm not a doctor. This isn't medical advice. If you need legal advice, speak to an attorney. If you need medical advice, speak to a doctor. I'm sharing with you my experiences that happened with my mom. Okay, guys? They can get better. You just have to take those extra steps and make sure that everything's covered. Because that's your loved one, right? As long as they live, you want them to have the best possible life there is, okay? Take care, guys. Happy Labor Day to all of you. Today is September 2nd, 2024. I hope you're doing well.